Hello and welcome into Patient Preferred Presents. My name is Jay McFarland, and today I'm very excited to introduce you to Patient Preferred physician Dr. Michael Sutker. Dr. Sutker specializes in using minimally invasive techniques to treat general and bariatric surgery conditions, mostly using robotic-assisted laparoscopy. All right, doctor, it's such a pleasure to have you on the show today. I always like to start out with the question, what did you want to be when you grew up? Was it always a doctor, or what was your initial thinking?
Yeah, I always wanted to go into medicine. I never really ever seriously considered doing anything else. From the time I was little, it's always what I wanted to do. I always liked science. I always liked math. And then my dad's an orthopedic surgeon, and so he would come to my elementary school and bring a skeleton, and I was always interested in learning about that. And then just as I grew up, I worked in his office, and then I did pre-med classes in college, and as said, it was about the only thing I ever really gave serious consideration to.
Wow, so you were focused from day one, no doubt whatsoever.
Pretty much.
That's amazing. Most people I talk to, they waver, they've gone through other things, they stumble into it, but not you. You were right there.
No, through the pros and cons of everything, I still, even now, there's nothing else that I would rather be doing than what I'm doing now.
Very good. And then the next question I like to ask is, why did you choose to specialize in bariatric and general surgery?
So, yeah, initially, growing up, my thought was always, let me go into practice with my dad, let me go to orthopedic surgery. And as I went along in my training, as I went along in my consideration, I definitely knew I wanted to do a surgical specialty. I like working with my hands. I kind of like the ability to see a problem, fix the problem, and the patient can move on. And ultimately, I really liked the variety that general surgery brought. And it was just something different. It was the opportunity for me to kind of forge my own path, not being in my dad's shadow, and do something new and different. And so general surgery I really liked a lot. I liked the technology behind minimally invasive surgery. I liked the laparoscopy. And then as I got further along, I liked learning about the robotic technology. And so bariatrics was sort of an extension of that, where there's there's neat instruments and cool toys and good technology and lots of research going on. And so from the technical aspect, that was something that was really appealing. And then the great thing that I found about bariatric surgery is that I do get sort of longitudinal care. It's not just I see the patient once, I operate, and then I never see them again. I do get kind of that primary care mentality where I get to see a patient, get to see them not just one visit, but at 3 months and at 6 months and at a year and 2 years. And I now have patients that have been coming back to me for 5 years, 7 years, and I get to see their long-term success, which is really cool as well.
Yeah, that's awesome. I love how you talk about technology and new toys. I'm the same way with computers and that kind of stuff. I did see a survey recently that said people are still skeptical about robotic surgery. Do you find that a lot?
Generally, no. So when we say robotics, it's not anything autonomous. I am in complete control. It's really just fancy equipment. And the best analogy that I've learned to give people is when you go take your car into the shop, it's obviously this big, expensive piece of technology. And you would never think of telling your car mechanic, well, I want you to use this wrench and this piece of equipment from this company. I don't want you to use it something else. Ultimately, what you say is, fix the problem, do it whichever way is most comfortable for you. And that's kind of how I look at robotic technologies. For me, that's how I feel like I can get the best results for my patient. But, somebody else may use a different piece of equipment. They may do a traditional laparoscopic approach versus me, who does a robotic assisted laparoscopic approach. And ultimately, it's what I can do safest, and it's what I can do to get the patient on their way, where they don't have to worry about it. But never is the robot per se in control. I'm always managing all the different things myself.
And then how do you keep up with it? I'm guessing this technology is moving forward very quickly.
Yep. So lots of different avenues. So social media is a great spot. People are always posting I tried this technique, or I did this, or there are videos. The companies themselves provide a lot of education. There's lots of articles and research that come out all the time in our journals. So I look at that. And then going to conferences, they always have the vendors and the technology there to actually get to lay my hands on it. There's training courses. There's lots of different avenues, because ultimately I will never use an instrument or a piece of technology that A, I don't feel comfortable with, B, that is not supported by the vendor, and C, is not readily available to me. And so those are sort of my criteria for trying something new.
Yeah, I love that. I'm curious, is there a procedure that you like to specialize in that has the biggest benefit, or you just treat them all the same?
Oh, I kind of like I enjoy doing everything. Bariatrics especially, I think, is great for the robotic platform. Sometimes the patients with their body styles make it a little bit difficult, and so having the robotic platform does make surgery technically easier. And for me, when surgery is easier, it means ultimately safer.
Yeah, and less invasive, right? And more likely to be outpatient. Does that technology help that, or?
It does. I mean, I can do some really complex surgeries quicker, with fewer incisions. And yeah, a lot of times that equates to patients going home from the hospital a lot faster. I tend to see a lot of patients who've had previous abdominal surgery, previous weight loss surgery, and so this may be their second, their third, their fourth operation. And many years ago, people would need a big incision on their belly. Now I can still do it with a couple little incisions, and still get the great benefit of doing it that way.
Yeah, to me, I'm so fascinated by the technology, and I love it. I'm all in on it. I know some people are skeptical, but I just think it's the future, and we need to embrace it now.
Yeah, I mean, I'm going on 2,000 cases with the technology, and I know how to troubleshoot it. I know what its limitations are, and there's nothing that I would be doing differently about what I'm doing. So I really think, for me and in my hands, it's an absolute benefit of what I can offer.
Well, I love your passion. I can tell you really enjoy helping people and using this technology. I probably know the answer to this, but what gets you up in the morning when you're like, today I get to do ... What would you say?
I mean, I love my surgical days in the OR. It's getting up, getting the patient in, finding the problem, fixing the problem, getting them moving along. It's a great atmosphere working with my nurses and with my techs and my anesthesiologists and getting to interact with the patients. I mean, those are by far my favorite days, is when I get to be in the operating room. It's obviously one of the reasons why I became a surgeon.
Yeah, absolutely. I'm curious, do you have any favorite success stories? Obviously, you can't give names or anything like that, but when you just felt yeah, go ahead.
I mean, I just seen a patient. I had a patient who weighed almost 500 pounds, poorly controlled diabetic, heart failure, high blood pressure. Did an operation on the patient, and within 6 months, off diabetic medications, off most of the blood pressure medications, lost 150 pounds, and just to see the difference in their attitude and their activity, it's just pretty amazing. So, and frankly, that's a relatively similar story to a lot of patients. With weight loss surgery especially, you just can see such a massive difference so quickly in terms of health and activity as a result.
Wow, what an amazing story. I mean, that has changed their life dramatically, but also extended their life, I'm guessing.
Yep, absolutely.
Yeah, that's a really big deal. Is there, after a procedure like that, is there a possibility that they return to their previous state, or that they go backwards a little bit?
There are small percentage of patients who do get some what we call recidivism, where that rate can come back. It's less than 10 to 20%, so it's a pretty small minority. But the way I look at obesity is the way that we look at any medical problem. So, for instance, if you have high blood pressure, you start with one medication and your blood pressure may stay controlled, but eventually you may need a second medication or a third medication. And obesity is like that, is just because you have surgery, that doesn't mean that's the end of your treatment and you don't need anything else. Surgery itself goes along with diet and with exercise, and sometimes we add medication. Sometimes we do revisional surgery. It's all a spectrum of the disease, and it's just not one shot and then you're done. It requires ongoing maintenance.
Yeah, and I'm assuming they have to do their part: exercise, try and eat well, those types of things.
Yeah, I mean, surgery is just a tool in one's box in order to be able to achieve goals. I don't necessarily care so much about weight and scale per se. Whether someone is 300 pounds and they go down to 200 pounds or 180 pounds, to me is not as important as, do they feel better? Are they off medications? Are they more energetic? Are they able to do more activity? Did they add years to their life by getting rid of some of their medical problems? To me, that's just as important. But in order to do that, you take surgery into account, you take how you eat, what you eat, your activity level, all of those things factor in to be able to be successful.
Yeah, very good. I'm curious about your thoughts on whether or not obesity can be genetic. I have a sister-in-law who she is the picture of perfect health, but I know her eating habits, and she is eating junk food all day long, every single day. And then you have my wife, who just nibbles on things because she can't take the weight off. She exercises like crazy. And I realize those are two anecdotal stories, but yeah. I'm curious to get your thoughts on that.
Yeah, there is absolutely a genetic component to obesity. There are absolutely genetic predispositions to obesity. There's genetic problems that actually lead people to overeat and not lose weight. But then we also see sort of predispositions where lots of members of a family are going to be obese, where I may talk to a patient and their dad's had surgery and their sisters had surgery and their aunts had surgery because it runs in the family. So genetics is certainly a big component of it. Environment is certainly another component of it. And we know socioeconomics are a component of it. What resources a person has available to them in terms of grocery stores and kinds of food, and the health of the people around them, that can also contribute to as well. So it's not one factor that contributes to obesity. It's a variety of different factors and how those things play together. But the one thing I always like to tell my patients, it is not a personal failure. People don't choose to say, I'm not going to work hard, I'm not going to try and get to a healthy weight, I don't want to do that. Almost every single person that I see, in fact, probably every person that I see, has tried really hard to get the weight off. I've never heard someone say, I've never tried before, or, I tried really hard and I'm not going to do it anymore. Everybody tries hard. But now our bodies have, as I said, we have this genetic predisposition, our physiology changes, so it makes it really hard to lose weight.
Yeah, and I think the stigma of people in this category from our society is really detrimental. My wife always says that everybody has issues, and we don't see those issues because they don't manifest outwardly. But obesity is one of those things where we all know, and we treat it like it's your fault. We don't acknowledge any of the outside conditions, and I think that that's unfortunate.
No, I would completely agree with you. There's absolutely a bias against patients with obesity just from the way we talk to patients, the way we talk about them, the way they're portrayed, whether it's in media or even within the medical community. It's a struggle no matter where you look, and so being able to be sympathetic to that, I think, is really helpful to be able to treat patients appropriately.
Yeah, I totally agree with you. What is the guideline for somebody? When do you decide that surgery is the answer versus diet changes or other things like that?
So typically our very clear-cut criteria is a BMI of greater than 40. BMI is a number that we calculate based on your weight and your height. You can just Google BMI calculator and plug it in. But in general, a BMI of 40 is somewhere around 75 to 100 pounds overweight. And so any of those patients are really considered a good candidate for surgery. We know patients with a BMI of 35 to 40 that have evidence of obesity-related disease, such as high blood pressure, high cholesterol, diabetes, sleep apnea, arthritis, heart disease. Those are all medical problems that if your BMI is 35 to 40 with one of those problems, that can also make you a candidate for surgery. And that's typically what Medicare, what Medicaid, what insurance companies will look for in terms of getting approval for surgery. We also know that patients with diabetes with a lower BMI, like a BMI of 30 to 35, they will greatly benefit from surgery, but it's not typically something that insurance itself will pay for.
Okay, so then they have to make the choice whether or not they can,
Correct.
They can foot that bill or
Correct.
not. Yeah.
Yeah, that's kind of what we call metabolic surgery as opposed to bariatric or weight loss surgery.
Okay, so I'm getting a great education here. You also deal with other issues that don't seem like they're as big, but for people who have it, like acid reflux is something that you also focus on.
Correct. They're all, for the most part, reflux operations are very similar to weight loss surgery operations because they all manipulate the stomach. In fact, a gastric bypass, one of our weight loss operations, is actually a perfect operation for someone who has obesity, but then they also have reflux on top of that because that essentially cures reflux as well. We do have several different options for reflux treatment. Medications are great for a lot of people, but they really only treat the symptoms. They don't treat the problem. So medications get rid of the acid, but they don't actually prevent anything from refluxing into your esophagus. And so surgeries, we essentially have three options. The first is the standard, what we call a fundoplication, where we take the fundus, the floppy part of the stomach, and perform a wrap around itself. The newer option that I like to offer is called a Lynx device, which is a string of magnetic beads that opens and closes as we swallow, that allows food to go down, but doesn't allow acid to come up. And then, like I said before, the third option is a gastric bypass, which is great for a patient who has obesity, but also has pretty severe reflux as well.
So I can totally sense your passion, but you are changing people's lives every single day in a dramatic
reflux
way.
Reflux can be absolutely debilitating. People who don't get treatment, or even people who fail treatment, they have to stop eating at a certain time. They have to prop themselves up with pillows at night. Sometimes they get a sore throat. Sometimes they get asthma. A lot of people have to cut out, a lot of pleasure foods, chocolate, wine, pastas, tomato sauce, all of those things, because they can just make their reflux worse and then give them this debilitating chest pain. And so the ability to treat that and get rid of that can really impact people's lives.
Very good. I'm curious if there's something on the horizon that you're watching for in technology or any of the procedures that you do that you're like, now that's going to be a game changer. Can you think of anything like that?
Not off the top of my head. I mean, with the robotic technology, they're always coming out with new instruments and, a better camera, better controls. So they're always trying to fine tune that sort of stuff. But nothing that I'm aware of off the top of my head that seems like it's going to be a game changer at this point.
Okay. And then I'm curious about your personal life. What are some of your hobbies outside of work?
So I like spending a lot of time with my family, with my wife and my kids. I enjoy reading. I enjoy listening to audiobooks. I read a lot of comic books and watch a lot of movies. I enjoy doing crosswords. My son and I really like playing with Lego. So really trying to focus on my time outside the hospital. I'm just understanding just how important that is, that I love my job. I love, working with patients, but in order to be able to do that well, I got to be happy when I come home.
All right, then this is a very important question. DC or Marvel?
DC.
Really?
DC and comics, Marvel and movies.
Okay, I actually like that. I think that's a very fair answer. And then, do you have any kids? I'm not sure how old they are, but do you have anybody who's just like you, saying, I'm going to be a doctor when I grow up?
My son says this now, so we'll see. He's only 8, but definitely says he has an interest. In fact, he had to fill out something for school today, and that's what he put, is he wants to be a doctor.
Oh, really? That's fantastic. Does that make you proud, or I'm assuming you'd support whatever they want to do?
Whatever he wants to do, I'm fine with.
Yeah, very good. And you've been named a patient-preferred physician. Can you talk a little bit about what that means to you?
I mean, it's just nice to get the recognition. It's obviously not necessary by any means, but the fact that I work hard to try and take care of my patients, develop a rapport with them, and then to get recognized by doing that is, it's just nice to be able to understand that, hey, it's not just me; it's that someone else is recognizing the hard work that I'm putting in.
Yeah.
And then obviously it's nice to be able to connect and have resources to other physicians who have been recognized the same way.
Yeah, one of the things that really sticks out to me in just talking to you, I can tell that relationships are very important. I think so much in the medical world, we feel like doctors have to turn them and burn them because of billing and all the insurance requirements. But it seems to me like the long-term relationship is what you thrive on.
Yeah, I mean, I like both. I don't think my personality is such that I'd want to be a primary care provider who, sees all of their patients for 15, 20, 25 years. But on the other hand, like I don't want to, as I said, I just don't want to see someone and have them ride off into the sunset and that be all that I do. I really do like the mix that I get in between. And obviously I'm very happy that there's other physicians out there who like doing things different than me because, everybody has their own niche and what they're good at.
Well, I have to tell you, it's been a pleasure getting to know you. I love your passion and your excitement for what you do, and be interesting to see if your son follows in your footsteps.
Got a few years, but yeah, we'll see how that one plays out.
Well, very good, Doctor. Thank you so much for joining us today and for what you do.
All right, awesome. Thank you so much for having me.
Once again, I want to thank Dr. Sutker for joining us and for sharing his experience, his insights, and his passions for helping people. My name is Jay McFarland, and this has been another edition of Patient Preferred Presents.